Sa kalusugan, kami ay nagkaisa. Hawak kamay, ngiti aming taglay, upang kayo ay mapaglingkuran. Tapat na serbisyo sa bayan.
Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay. Kaligtasang tunay. Bangon na, tayo na, harapin ang umaga. Wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa. Patungo sa buhay na puno ng pag-asa. Kapit-isip nating dalhin ang saya't ligaya. Sumama ka, tayo na. Mula noon hanggang ngayon, tuloy ang pangako at asam na layon. Katulong kami sa pagmulat at pagbangon, patuloy sa pagbabago at pag-ahon. Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay. Kaligtasang tunay. Bangon na, tayo na, harapin ang umaga. Wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa. Patungo sa buhay na puno ng pag-asa. Kapit-isip nating dalhin ang saya't ligaya. Sumama ka, tayo na. Bangon na, tayo na, harapin ang umaga. Wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa. Patungo sa buhay na puno ng pag-asa. Kapit-isip nating dalhin ang saya't ligaya. Sumama ka, tayo na.
Tayo na,
Tayo na.
tayo na,
Tayo na.
Sa kalusugan, kami ay nagkaisa. hawak kamay, ngiti aming taglay, upang kayo ay mapaglingkuran, tapat na serbisyo sa bayan.
Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay, kaligtasang tunay. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-bisig nating dalhin ang saya't ligaya. Sumama ka, tayo na. Mula noon hanggang ngayon, tuloy ang pangako at asam na layon. Katulong kami sa pagmulat at pagbangon, patuloy sa pagbabago at pag-ahon. Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay, kaligtasang tunay. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-bisig nating dalhin ang saya't ligaya. Sumama ka, tayo na. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-bisig nating dalhin ang saya't ligaya. Sumama ka, tayo na.
Tayo na,
Tayo na.
tayo na,
Tayo na.
Sa kalusugan, kami ay nagkaisa, hawak kamay, ngiti aming taglay, upang kayo ay mapaglingkuran, tapat na serbisyo sa bayan.
Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay, kaligtasang tunay. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-isip nating dalhin ang saya't ligaya. Sumama ka, tayo na. Mula noon hanggang ngayon, tuloy ang pangako at asam na layon. Katulong kami sa pagmulat at pagbangon, patuloy sa pagbabago at pag-ahon. Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay, kaligtasang tunay. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-isip nating dalhin ang saya't ligaya. Sumama ka, tayo na. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-isip nating dalhin ang saya't ligaya. Sumama ka, tayo na.
Tayo na,
Tayo na.
tayo na,
Tayo na.
sa kalusugan, kami ay nagkaisa. Hawak kamay, ngiti aming taglay, upang kayo ay mapaglingkuran, tapat na serbisyo sa bayan.
Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay, kaligtasang tunay. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-isig nating dalhin ang saya't ligaya. Sumama ka, tayo na. Mula noon hanggang ngayon, tuloy ang pangako at asam na layon. Katulong kami sa pagmulat at pagbangon, patuloy sa pagbabago at pag-ahon. Kalinga at pagmamahal, yan ang aming alay, patungo sa kaligtasang tunay, kaligtasang tunay. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-isig nating dalhin ang saya't ligaya. Sumama ka, tayo na. Bangon na, tayo na, harapin ang umaga, wastong kalusugan, ang ating sandata. Halika na, sumama ka, tayo'y magkaisa, patungo sa buhay na puno ng pag-asa. Kapit-isig nating dalhin ang saya't ligaya. Sumama ka, tayo na.
Tayo na,
Tayo na.
tayo na,
Tayo na.
Good morning, everyone. Welcome to our first DOH Hospital Summit. Thank you so much for celebrating with us. We are very grateful for your presence here today. To fully enjoy this lecture without any problems, here are some reminders. Be on time. Set your alarm and log on a few minutes early. Participate. Don't multitask. Stay focused, take notes, and contribute. Limit distractions. Find a quiet place and check your surroundings. Show respect. Practice good etiquette. Listen, be respectful, and be considerate. Mute yourself. Mute yourself when you are not speaking. And lastly, chat responsibly. Use the chat box to ask questions. Watch out for gossip, it may be recorded. To further enhance your learning experience, please take note of the following reminders. All participants must answer the online evaluation tool at the end of the second day of the DOH Hospital Week Summit in order to qualify for an e-certificate. The e-certificate will be sent to your respective emails within 5 to 7 days upon the receipt of the participant's evaluation. The views and opinions expressed by the hosts and speakers do not necessarily reflect the organization and the management. In the event of any technical disruption, the virtual program will resume through the same link. This online activity will be recorded as intended for documentation and educational purposes. Should you experience any technical difficulties, please send a chat message in the chat box. Once again, good morning, dear colleagues. While we are waiting for the others to accomplish their registration, I would like to ask you to settle down as we are about to start our program in 5 minutes. Thank you. We are very blessed that we are given the opportunity to be gathered in this special event. I ask everyone to place ourselves in the presence of the Lord as we have the ecumenical prayer to be led by Father Jerry Orbos, to be followed by the Philippine National Anthem.
Hi, this is Father Jerry Orbos, SVD, greeting you all a happy celebration, National Hospital Week celebration 2024. And let me greet you with a Korean greeting. I was in Korea, I speak Korean as a missionary, and the greeting is 안녕하세요, 안녕하세요, a greeting of peace. I hope and pray that you are at peace, that your work will be something that's beautiful for peace, and you work together peacefully. The second greeting is kamsahamnida, maraming salamat po. Salamat po sa lahat ng mga ginagawa ninyo to help other people. You know, it's a privilege given to you to be able to help people, especially the poor and the sick. And the final greeting is kamsahamnida, saranghe, mahal ka namin, Panginoon, at mahal kayo ng Panginoon. May this work be offered with love, with the heart. So I bless you all. Bless the work of your hands. Prosper the work of your hands, but more so, increase the love in your hearts. That whatever you're doing, you do it with love of God and love for our people. And you are blessed. That in everything we do, yes, there is medicine, but don't forget, the greatest healer is God Himself. Tinataas po namin, Panginoon, lahat ng mga pasyente, mga may karamdaman, may sakit. Sana po, madama nila ang iyong pagmamahal, especially this time when they are sick. May they come closer to you in their pain, in their sickness. Sana po madama nila ang iyong pagmamahal. Pinagdadasal po namin, healing physically. Lord, kayo po are the greatest healer. We believe, we trust, surrender. BTS. Believe, trust, surrender. Kasama na rin po healing emotionally. Na sana po hindi mabigat ang pagtanggap namin. Puno po kami sana ng pag-asa, kaligayahan, at hindi po nawawalan ang inyong pagiging presente, ang inyong presensya sa anumang pinagdadaanan namin. At sana rin po spiritual healing. Itong pinagdadaanan naming sakit, hirap, mapapalapit po kami sa inyo at madadama namin ang pag-akap po ninyo sa amin. Lord, wala pong imposible. Kayo po ang aming pag-asa. Bendisyonan po niyo ang lahat ng mga pasyente and help them to be patient, to be hopeful and trusting. And remember this, my suffering is my offering. Ialay mo, ialay ninyo anumang paghihirap at sakit. You offer it all to God joyfully. Mahal naming Panginoon, please bless and reward all health workers, frontliners. First of all, Lord, salamat po sa presensya nila, lalong-lalo na po ng COVID. They risked their lives. They went beyond the line to really serve people. Please bless, protect, and reward them. At sana po madama nila ng kanilang ginagawa, all our health workers, what they are doing is true love and service for people and love for you. It's a mission. Sana po makita nila palagi na ito ay isang mission para sa kanila. Sana huwag po sila maguluhan sa commission at mga consumption dyan, but stay focused on the mission to love, to heal, and to serve. Dear health workers, you are angels in white robes. Mapalad kayo with this opportunity na makatulong sa mga tao, lalong-lalo na sa mga mahihirap at mga walang-wala. Today, you tell the Lord, as for me and for my house, we will serve the Lord. From the book of Joshua. God bless you. So I bless all of you for this wonderful celebration, National Hospital Week celebration. Don't forget, mahal na mahal tayo ng Panginoon. And don't forget, whatever you do to the least of your brothers and sisters, you do it for the Lord. Ano mang ginawa mo sa iyong kapwa, lalong-lalo na sa mga hihirap, you do it for the Lord. God bless you, and Mama Mary loves you. Amen.
In the name of the Father, and of the Son, and of the Holy Spirit. Amen. Our most gracious Heavenly Father, we come to you today to praise and worship you and give you thanks for all the things you continue to provide for ourselves and our families. Father, we humbly ask for forgiveness for all the times you have offended you. Continue to guide and protect us, Lord. Bestow upon us your unending grace and healing, that we may in turn become instruments of gentleness and compassion to others. We ask all this in the name of your Son, our Lord Jesus Christ, with prayer and intercession of our Blessed Mother. Amen.
بسم الله الرحمن الرحيم اللهم إياك نعبد وإياك نستعين اللهم اهدنا الصراط المستقيم اللهم وحد صفوفنا بين المسلمين والنصارى واللوماد إلى صراطك المستقيم اللهم امنحهم العيش بالأمن والسلامة والتنمية المستدامة في مدينة دافاو اللهم لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار والحمد لله رب العالمين.
Amoy nen manama kami gimot tolangon, manotod kakaroson no, si koykaw kaming dokul tolangon, huway migtumpi to tano, si koykaw kaming bohoy to kopianan tolangon na maotaw, pusako kapusong no, kana akong to pabulos koy, o agbuyo koykaw, huway bohoy kat pabor, kahalaan, kalinaw, to kanami, no pag-ugpo, huway kasabok kakoy, oyot kalambuan. Kay kuro tamana kakodin panubad way pag-ampo, kaupianan igboy no, way kakoy kong imono, way kahalaan ko lang.
Silanganan, ala
Good morning to our distinguished resource speakers, esteemed guests, my dear colleagues, and delegates from all over the country. As healthcare workers, we took an oath to do no harm. We are bound to uphold this as this is the most fundamental principle of healthcare service. Despite of this, there is a rising number of patient harm across developing healthcare systems. Medication errors, healthcare-associated infections, patient falls, pressure ulcers, and patient misidentification, to name a few. According to the World Health Organization, around 1 in every 10 patients is harmed in healthcare, and above 50% of those harm is preventable. Welcome to the first Department of Health Hospital Week Summit 2024 with the theme Safe Hospital, Strengthening Advancement and Fostering Enhanced Collaboration in Patient Care. From Jose R. Reyes Memorial Medical Center, I am Nikki Angela Orantia, and I will be your moderator for today's summit. Greetings also to our online viewers. Thank you for tuning in, for we are live from the Department of Health and Jose R. Reyes Memorial Medical Center's official Facebook page. We would like to shout out our viewers from our Facebook page. From Eastern Visayas Medical Center, good morning everyone. Attending from Vicente Soto Memorial Medical Center Office of Strategy Management. And greetings also from Panay Healthcare MPC Hospital from Calibo, Aklan. Also for our viewers from the ENT department, good service, thanks. We would like to also read some comments from the NCH Department of Radiology. And also, lastly, greetings from Jose R. Reyes Memorial Medical Center. We would like to recognize the presence of our Medical Center Chief, Dr. Wenceslao Lauderes, and the chair and the co-chair of the Medical Center Chief of the National Children's Hospital and the co-chair of the National Hospital Week celebration, Dr. Philip Morales. We would also like to welcome our dearest Secretary of Health, Secretary Teodoro Herbosa, members of the DOH Executive Committee, DOH officials, the Medical Center Chiefs with their respective executive committees, our dear regional directors, assistant regional directors, chief of hospitals, at sa lahat ng makabagong bayani ng Pilipinas, ang mga kawani ng kalusugan sa buong Luzon, Visayas, and Mindanao. To formally start our program, to give us his welcome remarks, please help me welcome the Assistant Secretary of Health, Dr. Ariel I. Valencia.
A pleasant morning to all of you. It is an immense privilege to welcome you all to the inaugural Department of Health Hospital Week Summit, which has the theme Safe Hospital, Strengthening Advancement and Fostering Enhanced Collaboration in Patient Care. This is one of our core events for this year's National Hospital Week, with the theme Ligtas Pinas, de Calidad de Servisyong Ospital. This theme underscores our commitment to improving our standards for patient care and safety. We are honored by your presence as we embark on this critical journey toward a safer and stronger health system. Your commitment to strengthening patient care is truly inspiring, and we are deeply grateful for your participation in this momentous event. The World Health Organization has identified that around 2.6 million deaths occur every year due to unsafe care. We can commit to decreasing this number through different means, such as system-level efforts and continuous education and training. This summit will be a platform for all of us to commit to this role through sharing knowledge and having a dialogue on the importance of leadership, healthcare workers' welfare, technology, research, and best practices for leveraging the safety of our patients in receiving their needed care or treatment. We commend and thank our resource person from the Department of Health and various hospitals and societies who will share their expertise and knowledge with us today. For the next 2 days, we encourage everyone to actively participate in the sessions, engage in thought-provoking discussions, and build meaningful connections with your peers. The lessons and insights we will gather during this summit will surely benefit not only our facilities, but most importantly, our patients. Thank you once again for being part of this remarkable journey towards a safer and healthier future. Dahil sa bagong Pilipinas, bawat buhay mahalaga. Again, good morning. Thank you very much.
Thank you so much, Dr. Valencia, for that insightful message. Please let us give him a virtual round of applause. Like what Dr. Valencia said, we hope that we have your full participation in this event. Once again, thank you, Dr. Valencia. Moving on to give his opening remarks, please help me welcome the Undersecretary of Health, Dr. Abdullah B. Dumama Jr.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Assalamu alaikum warahmatullahi ta'ala wabarakatuh. Congratulations, my fellow health workers, on the celebration of this year's Hospital Week and the conduct of this summit. Our fortitude amidst challenging times remains steadfast, demonstrating only but our genuine sincerity towards safe, reliable, and compassionate public service. My courtesies to all the dignitaries present, especially to our beloved Secretary, Dr. Teodoro Ted Herbosa, to all my fellow EXICO members, to all the executive directors of the specialty hospitals, to all the medical center chiefs and chief of hospitals, and to all the presenters, guests, friends, ladies and gentlemen, magandang araw po sa ating lahat. As we move forward, improving and establishing modern health facilities across the country, let us be conscious of the intangibles too. More than the edifice we arrange for, let us develop a culture which exudes care and compassion as well. Let us treat our clients as persons first and not a burden to take care of. Let us secure an environment conducive for healing and improved well-being and not an atmosphere where everything seems to be just mere processes along the production line. In order to reach this, we shall invest on creating an encouraging work environment for our health workers so everyone achieves a life-work balance. Kapakanan at karapatan ng mga health workers ay ating isusulong. After all, it is through human touch where we can express care and compassion. Hence, I am appealing to everyone. Let us help one another to make our hospitals an epitome of wellness. While we invest heavily on infrastructure and equipment, we shall take care of our frontliners too, because it is through our collaborative efforts where we will be able to reach this state. As I often say, if we wish to finish stronger, we need to work together. It is my fervent prayer that we shall be blessed abundantly, that we shall be protected from harm perpetually, that we shall remain a beacon of truth consistently and a carrier of profound compassionate care faithfully. Congratulations everyone! Mabuhay ang mga manggagawang pangkalusugan. Sa bagong Pilipinas, bawat buhay mahalaga. Maraming salamat po.
Thank Thank you so much, Dr. Dumama, for that inspiring message. It is true. We shall remain carrier of safe patient care. Let's give him a virtual round of applause. And moving on to introduce our next keynote speaker. Our keynote speaker has extensive experience in trauma surgery and disaster and emergency medicine. In the University of the Philippines, he started the fellowship program for trauma surgery and the residency program in emergency medicine. He has also held several international posts. He was a professor at the emergency medicine at University Kebangsaan, Malaysia from 2007 to 2010. He created the Center for Research in Emergency Medicine and produced the first batch of master graduates in emergency medicine. He was also an international associate for Johns Hopkins University, implementing the hospital preparedness for emergency scores and the peer program which was funded by the USED. He is also a former board member of the World Association for Disaster and Emergency Medicine. He participated in the World Health Organization's Safe Surgery Saves Lives Task Force that developed the WHO Safe Surgery Checklist. He was the Executive Vice President of the University of the Philippine System from 2017 to 2021. He further expanded knowledge of the university on the road safety emerging interdisciplinary research and created the UP COVID-19 Pandemic Response Team, which has been overseeing the safety of all the university's employees across the country. He is a professor of emergency medicine and trauma surgery at the UPPGH and faculty at the National Telehealth Center at UP Manila. To give his keynote address, or the so-called TED Talks, let us all welcome the Secretary of Health, no other than Dr. Teodoro J. Herbosa.
To Undersecretary Abdullah B. Dumama Jr., Universal Healthcare Health Services Cluster Lead, Dr. Wenceslao S. Lauderes, Medical Center Chief 2 of Jose R. Reyes Memorial Medical Center, Medical Center Chiefs, employees of participating hospitals, honored guests, advocates, ladies and gentlemen, magandang umaga sa inyong lahat. I am delighted to address you today at the DOH Hospital Summit with our inspiring theme, Safe Hospital, Strengthening Advancements and Fostering Enhanced Collaboration in Patient Care. The theme captures our commitment to making our hospitals safer, more innovative, and more collaborative. Patient safety is not just our goal. It is our duty. It is the foundation of protecting and enhancing health in our communities. Today's summit is about pushing boundaries, preventing errors, reducing harm, and embedding a culture of safety across all healthcare settings. Together, we aim to drive advancements in patient care and safety through innovation and collaboration, elevate standards of care, improve patient outcomes, and create an efficient healthcare ecosystem. Transform patient care and safely by sharing knowledge and resources to every patient that receives the best treatment and support. As a trauma surgeon, patient safety is a cause close to my heart. In fact, back in 2009, I co-authored the surgical safety checklist designed to minimize risk for patients undergoing surgery. Since 2020, the Department of Health has made impressive strides in patient safety across the Philippines. We've established a National Patient Safety Committee and created patient safety units and officers in health facilities nationwide. Our online basic course on patient safety and quality improvement is helping healthcare workers learn vital skills, and an advanced course will soon be available to deepen our expertise. We're using tools like the modified WHO surgery safety checklist and the client experience survey to enhance safety and improve patient experiences. We have also strengthened the monitoring of safety indicators through electronic data collection. Every year, on September 17, World Patient Safety Day gives us the opportunity to expand our partnerships and collaborations. Next year, in April 2025, we are the proud host of the 7th Global Ministerial Summit on Patient Safety here in Manila, highlighting our commitment to this cause. We understand the complexities of healthcare and we are dedicated to strengthening our capacity for patient safety. The commitment is central to our 8-point action agenda sa Bagong Pilipinas Bawat Buhay Mahalaga, which focuses on delivering safe, high-quality, and people-centered services in the second action agenda. This summit is an incredible opportunity to exchange insights, build partnerships, and develop strategies that will enhance patient care across the Philippines. Together, we can ensure that every patient receives the highest standard of care, that our healthcare system continues to evolve and improve. To all hospital administrators and employees present, I want to express my gratitude for your dedication to patient safety and healthcare advancement. Your work is making a significant difference in the lives of all Filipinos. Let's continue to work together to build a safer, more efficient, more effective healthcare system for everyone. Dahil sa bagong Pilipinas, bawat buhay mahalaga.
Thank you so much for your words of wisdom, Dr. Herbosa. Thank you for gracing us with your presence. I'm sure everyone is very eager and looking forward for today's topics and discussions. Again, thank you so much. So, how are you guys doing? Are you guys feeling excited? I'm going to read some of your comments, so if you want to shout out, type in your comments and let me know how you feel. And also, can you write down in the comment section, good morning in your local language? So we have a few comments here from MVH. Good morning everyone from Dr. Digna Ragasa. From Bindoy District Hospital, they are sending their greetings. And also a message, thank you Dr. Herbosa for leading the way for a safer, more efficient and effective healthcare systems. Maayong buntag from VSMMC OSM. Maray na aga. Maayong buntag sa tanan. Good morning everyone. Mayap aabak. Good morning from Miss Christine. Gawis ay agaw. Tako amin from the LHMRH, Sir Johnny, good morning. Maayong buntag sa tanan from Miss Balisalisa, good morning. Maayong aga halins from Western Visayas Medical Center. Marhay na aga sa Indogabos from Sir Lopez, good morning. Maayong buntag. Wow, we have a lot of audience from around the Philippines. Maayong buntag from MRH. Naimbag nga bigat tayo amin from MMMH and MC. Thank you so much for your active participation. I hope to hear from you until the end of the summit. I just want to say that we have invited experts and top caliber speakers with us today. Make sure to tune in because we will definitely learn a lot from them. Having said this, let's move on to our first topic. Our first speaker is currently the project leader of Region 1 Health Research and Development Consortium and Philippine National Health Research System Research Management Committee. She is also a fellow of the Philippine Obstetrical and Gynecological Society and the Philippine Society of Maternal Fetal Medicine. She is also the recipient of various recognitions, including the Outstanding Filipino Physician Awardee in 2021, Gawad Career Executive Services Awardee in 2017, Most Outstanding Ilocano Awardee in 2016, Civil Service Commission Pag-asa Awardee in 2016, and was the Dr. Jose P. Rizal Gawad Karangalan Awardee from the Philippine Medical Association in 2012. She is the recipient of the Distinction Award of Medical Profession for Government Service category of the Philippine Federation of Professional Associations. To discuss the leadership's role in fostering a culture of safety, please help me welcome the Medical Center Chief 2 of the Mariano Marcos Memorial Hospital and Medical Center, Dr. Maria Lourdes K. Otaiza. Let's give her a virtual round of applause.
For my disclosure, I have no pretensions to being an expert on the topic, but this was an opportunity to learn more and perform a favor for Dr. Lauderes so he cannot deny my future requests. Good morning, and I hope that the next hour will be enlightening for all of us. We know that medical errors are deadlier than AIDS, motor vehicle accidents, or breast cancers. And it has cost, in 2009, at least 44,000 to 98,000 deaths annually. And 9.2% of hospitalized patients experience adverse events, of which 7.4% could be lethal. Unfortunately, 43.5% of these were considered preventable. The cost of medical errors run up to billions in a year, and the US Medicare does not reimburse hospitals for expenses if some types of medical errors occur during treatment, and we believe that other insurers will follow this lead. In the outline of our presentation today, we will deal with several slides on safety culture, defining it and giving some, describing some actions that we can do to create our own safety culture, and then go into safety leadership, our own occupational safety and health story at Mariano Marcos, and a few steps forward. Broadly defined, safety culture is an organizational culture that places a high importance on safety beliefs, values, and attitudes, and shared by the majority of people in the workplace. The Joint Commission defined it as, yes, beliefs, values, and attitudes, but added perceptions, competencies, and patterns of behavior that determine the organization's commitment to quality and patient safety. So a positive safety culture can result in improved workplace health and safety and organizational performance. In the DOH 8-point agenda, the welfare of the healthcare worker is paramount. pakanan at karapatan ng health workers, welfare and rights. This is our mandate to pursue the safety culture. Now, actions essential to ensure the creation of the culture of safety are called the 9 culture actions. And they involve number one, communicating the company values, demonstrating leadership, clarifying required and expected behavior, personalizing the safety outcomes, developing positive safety attitudes, engaging and owning safety responsibilities and accountabilities, increasing hazard or risk awareness and preventive behaviors, improving the understanding and effective implementation of safety management systems, monitoring, reviewing, and reflecting on personal effectiveness. Important thing, communicate the company value. What is the real message? And it should be safety first. It is not an extra task, but part of your everyday values and action. Demonstrate leadership. Act to motivate and inspire others to achieve a particular goal. Send clear and consistent messages. And you should have periodic checklists for the inspections. And you should also conduct periodic risk assessments. How to demonstrate leadership? This is very important to ensure compliance. You lead from the top down by seeking staff engagement and participation when developing safety tools, for example, checklists. Leadership can be fostered among all workers by developing ownership amongst them. We should develop and standardize behaviors or actions by clearly communicating um, the messages via emails, memos, conversations, huddles, and we have a lot of this in the hospital. We should address inappropriate behaviors, actions, or the lack of action, and reinforce appropriate behaviors with praise or thanks. Personalize safety outcomes. If the message is brought home, then there's a greater chance that you listen to the message. Make safety more obvious. You know that road sign that says, Daddy, please come home. So it's similar to this. Make it emotional for the individual. Communicate the personal impact of the risks of a process. Oh, this PPE is important for you to use so that any bug you catch in the hospital will not be brought home to your unsuspecting family. Everybody should wear this. Otherwise, you're going to spread the disease at home. The injury or fatality is not another anonymous statistic, but a workmate who has a name, a family, people who care and love him. So talk about it in the sense that in the sense that you name the person involved. What is the lesson to learn from Juan's accident? Emphasize that the hospital industry still has far too many avoidable injuries and fatalities. And what are the other consequences that could be suffered? Lawsuits, for one, we have a lot of them, and so many physical, what do you call this? Physical effects of being unsafe. For example, even impotence, the capability to reproduce, that could also be an implication or an injury caused by unsafe exposures. Foster the development of attitudes and beliefs that support safe behavior. Drive it down to where the risk exposure is greatest by developing positive behaviors and encouraging open and informed conversations. Managers are creating an environment where it is okay for anyone to challenge unsafe behaviors and attitudes in others. The next thing is how to develop positive safety attitudes. Some overall values, beliefs, and attitudes that should be fostered are regularly reinforced as personally relevant. And these are values like workers' lives and well being are important, and doing the right thing is important. Beliefs like speaking up about safety won't threaten my job, or if I do speak out, something will be done. You believe in that. If I don't act, I would be responsible if something happened. And we should also believe that good patient outcomes is about working safely. It is not a separate concern. The right attitudes involve my personal safety is more important than money. Well being and personal safety in the workplace are more important than money. And this is why Mariano Marcos can afford vaccines and employee medical services because we are taking care of our people. We should engage and own safety responsibilities and accountabilities. At a safe workplace, people will understand what they need to do and why they need to do it. Think about what they are doing before they do it, and look for hazards proactively and manage risks before they cause harm. So we should increase input, actions, and involvement in the safety management process by individuals. People who own the process will take care of hazards themselves without needing policing. They will believe that they are responsible and accountable for making sure that they and their workmates remain healthy and safe. They will follow workplace rules, like the way you stop at the traffic light, or if you see the picture of the x ray light on. You will not just barge into an x ray room where the procedure is ongoing. Ownership is indispensable. To encourage this, senior managers can do the following: engage the employees, get their input into safety management on a daily basis. You make them believe that their inputs are really important. And this reduces the us mentality versus them mentality in building trust. You do have to build relationships, creating a sense of belonging through team building. So we have a lot of socialization activities outside the workplace, or you can have regular conversations at the social level, inquiring about things that are going on and important in your colleagues' lives. Remember, even if a third of your life is spent at work, that is a very critical third of your life, and it should be happy. You should continue to have social contacts. We generate conversations about safety, subtly weaving it into conversations. Provide good amenities that promote interaction. Like, for example, in the picture, you have a water tank, and that's where people meet up. It shows that management cares for your well being. If you provide clean and tidy staff rooms, tea, coffee, hand washing facilities, and clean toilets. How do you demonstrate support? Trust people's judgments on safety and their opinion on work matters. Have an open door policy by encouraging people to speak openly about safety breaches, and empower those who raise safety issues by rewarding them and helping them to progress and resolve those issues. You see, listening is one of the more powerful leadership strategies. Increasing the hazard or risk awareness and preventing preventive behaviors increases the individual's understanding. If you have a two-way communication, a productive safety culture takes safety beyond just legal compliance. Because if it is implemented by rank and file without your prodding, then you're all set to developing your safety culture. Effective communication should be clear and direct, relevant to those receiving the message. Avoid blame because you're likely to cause defensiveness and people will stop hearing that message. Emphasize the personal impact of the action of or decision. So, for example, you can explain, because of your potential exposure to the pathogen, to this the virus, you will now have to be observed in quarantine. Or you can also say, and now you explain why you should not be charged for negligence. That now will uh, show the personal impact of their actions or inactions. Communicators are active listeners. Active listening is really hearing what the speaker is saying. And there are techniques for this. Mirroring, when you match and copy the language and body language, when you wear so those safety hats. And you ask people to make a reverse demo. The message should be consistent that safety is a shared responsibility. Everybody wears the safety hats. Confirm the message by repeating key points. Okay. So you have to ask what is the reaction to your statement. Give them a chance to defend what is their position. And you can paraphrase or summarize what has been said and to confirm shared understanding. Usually, this is done at the end of lectures, and you paraphrase the take home message. One should improve understanding and effective implementation of safety management systems. If senior managers are periodically on site, making rounds, and taking active interest in work health and safety, your commitment is demonstrated. So at this point, when, very early on when I was younger and I could do a lot of rounds, I would do theme rounds. And at, nowadays, when often I'm out of the hospital, the people after me, the middle managers, they do theme rounds, like in this case, safety rounds. My OSH team takes safety rounds. They do that. So nursing or my CMPS, he can go around checking the expiry dates of medications. Theme. There's a theme to the rounds to be more comprehensive because it is exhausting to stay in one place and look at everything all at one time. There should be the ability to systematically analyze and inspect entire working environments to identify and assess risks, and as well as design and implement the appropriate safety management systems and evaluate their effectiveness. We should assess the resources needed to establish and maintain safety management systems, prioritize hazards and appropriate controls, consider a range of control measures to address possible inadequacies, and then, of course, also know when to seek expert advice. Always reflect, monitor, review, reflect on personal effectiveness. Use various sources of information to get feedback. Central to any leadership approach is the ability to foster good relationships with other managers and the workforce so that you can elicit the correct, accurate information. If you behave safely, your workers are more likely to behave safely. Try to develop a style that promotes close involvement with workers to build trust and respect while still maintaining authority and adherence to the safety processes. Now to safety leadership. This is broadly defined as a management approach that prioritizes the inseparable integration of employee and patient safety in the workplace. It's a process through which leaders exert influence to motivate employees to achieve safety goals. And this results in better patient outcomes, improved quality of care, better healthcare worker and organizational outcomes such as fewer injuries, better job satisfaction, improved staff retention because of reduced burnout, and reporting of safety events. It's really about creating a culture of safety within an organization. So we can either be safety leaders and safety managers or even both at the same time because we have to be proactive in identifying potential risks and taking action to prevent them and still focus on compliance with regulations. We need to actively promote the safety culture, creating an environment where safety is a core value, and still monitor activities of our workforce. A bibliometric review of Zhang of 2,098 articles and 86,000 plus secondary documents was done in 2022 to provide a comprehensive view of safety leadership research. The safety-specific transformational leadership and relationship-oriented styles are reported to promote safety climates, safety consciousness, safety compliance, and safety participation, as well as reduce workplace injuries and unsafe events. In contrast, destructive, passive, dysfunctional leadership has been suggested to hinder the organization from achieving these safety outcomes. So, this study in particular described the future agenda for research in safety leadership. Tatilu um, said that there are at least two leadership models needed at the same time to build a patient safety culture. And these are namely transactional and transformational leadership. According to Jeffreyson, transactional leadership is an exchange of rewards for compliance, where the values that are relevant to the process are emphasized: honesty, fairness, responsibility. So there's a reward. Okay? On the other hand, Sally et al. Describes transformational leadership as the ability to motivate others to achieve high standards and long term goals. The first, transactional leadership, can be used to encourage staff to report incidents, while transformational leadership is used to learn from events and redesign programs for patient safety. There are four safety leadership goals. First, mentioned earlier, is to build trust. The second is to uphold regulatory policies. The third is to improve business resilience. And fourth is to protect employees. So there is a framework for building healthcare leadership competencies. You have three columns on the screen. The first is describes the three learning domains: personal attributes, core functions, and the gathering or mise en place. Then the 10 learning categories in the center of the table, where you're asked to exhibit leadership style, awareness, and adaptability, your professional and ethical conduct, the learner as a leader. Are you able to set direction, communicate effectively, and do you lead positive transformation? Do you deliver competently and effectively? Do you exhibit political and social astuteness? Are you able to establish crisis systems and use evidence and information for policy? So the third column shows the learning objectives that can be developed from the categories described. It is essential to recognize that preventable adverse events are indicators that there are interaction problems between the components that need to be addressed and corrected rather than focusing solely on one component part. For example, you can just say you might just easily focus or on infrastructure, but actually it's the relationship between another component like processes and infrastructure that causes the problem. Therefore, you should address both components. We should simplify safety, communicate regularly, establish a safe space for safety where you're able to talk about it, and personally become a safety advocate. So, how do you get buy in? From leadership, you should show compelling data, long term benefits, use tangible impact and cost information, talk about brand reputations, make use of examples from previous incidents. Employee buy-in is important because if the leaders see that employees believe in safety, then they have to listen. An important area in which hospital leadership can directly address safety concerns is through managing disruptive and unprofessional behavior by clinicians. As the management committee or hospital boards have oversight over the medical staff, they have the ability to ensure unprofessional or incompetent clinicians do not put patients at risk. A simple example, when you have clinicians with favorite toys, high-tech gadgets, and they start to worry about returns of investment. For example, a very high-end ultrasound. Are they going to start requesting that test just so you have an ROI and they can justify themselves to the board? So that's not a good practice. And the management has to look into that. So there are three critical facets of patient safety identified that are mediated by management perceptions, the teamwork climate, working conditions, and stress recognition. So management leadership should investigate, look into these facets to promote a culture of patient safety. By fostering an environment of psychological safety that encourages others to feel safe communicating issues and speaking up with concerns, leaders are able to act decisively and timely to protect patients and employees. Leadership determines organizational priorities, and you can funnel resources towards important safety initiatives. Issues raised by frontline staff during walk rounds must be promptly addressed, lest staff view the rounds as simply a visibility exercise for leadership. Engage those who took time to report the errors. And there is foundational value in these walkabouts um, to learn about how to lessen harm. There are actions to build and foster resiliency, continuous support and feedback, and there are opportunities to be taken to improve safety culture and climate. The Joint Commission suggested some actions. We have Zoom trainings on basic business etiquette, okay, um, to ensure that all team members have appropriate professional behavior, emphasizing respect. So you can even train phone skills and people skills. Hold all team members accountable for modeling desirable behaviors like setting deadlines, always expect the deadlines. Develop and implement policies and processes appropriate to the organization that address zero tolerance. And since clinical leaders are often the ones who opt for improvement and write out all these policies, it is the frontline staff who are expected to live out the changes. So medical staff policies should complement those for non-professional staff. Reduce fear of intimidation or retribution and protecting those who cooperate. Respond to patients, families, hearing them, emphasizing with them, thanking them for sharing their concerns and apologizing even for mistakes. How and when to begin disciplinary action should be also be laid out. So when do you suspend? When do you terminate? When do you declare a loss of clinical privilege or report to professional licensure bodies? So all of that should be part of your safety culture. Develop and organize the process for addressing intimidating and disruptive behaviors. Provide skills-based training and coaching in relationship building and collaborative practice. Um, Filipino, there is a culture, okay? The organizational culture develops from national cultural traits. Like Filipinos mas madaling mag-chika na lang, no? Something like that. Instead of addressing things directly and head on. The patient safety culture can be seen as a subject of organizational culture. So we have to unlearn some habits. We have to learn new ones. So cultural assessment tools can also be used to measure the changes over time. Develop and implement a system for assessing staff perceptions of the seriousness and extent of instances of unprofessional behaviors and the risk of harm to patients. You know, the chief nurse office and the station managers, nursing station managers, are critical in giving feedback. And I've used them several times already for validations. We can develop surveillance systems. Sometimes they can be anonymous for detecting unprofessional behavior. So, peer reviews, team member evaluations, you can use many strategies. In the beginning, we declared it unprofessional to send prescriptions out to the boticas that give rebates. So we developed a reporting system in the hospital so that we can suss out all these outgoing prescriptions. It's really trying to describe the behavior that should happen within your institution. Support surveillance with tiered, non-confrontational interventional strategies. Sometimes you start with calling them to the office or talking to them, meeting them outside, and discussing what the issues are. Initially, you can be non-adversarial because you're trying to get the confidence and build trust and injecting the issues of accountability. Eventually, you start to have you start to give memos, and you might even have to rotate them to rehabilitate the individual. Conduct all interventions within the context of organizational commitment to health and well-being of the staff. Of course, you have to give the resources to make this happen. Always encourage interprofessional dialogues through different forums as a proactive way of addressing potential conflicts or ongoing conflicts, overcoming them, and then moving forward. Document all attempts, do not forget this. Document all attempts to address intimidating and disruptive behaviors because this can also be your defense in the future. Common features of positive healthcare worker safety cultures. There are standards for prevention of workplace injuries and good working environments. There should be a situational awareness and mindfulness, like knowing what you don't know. And sometimes it's quite difficult. Um, General measurable elements of a safety culture. Do your staff really speak up? Are errors caught, corrected, reported? Is their staff hand off, and transition? So when they transfer information across work units or across the shifts, that is a very safe culture to you don't just endorse na toxic yung bantay dyan, but really it's also protecting the next shift that the bantay in that place is someone to be wary of. No? But other things that might endanger you, like a leak in the a leak in the roof, that should be endorsed. Something out of the ordinary should also be endorsed. So management provides and prioritizes a safety climate that promotes patient worker safety. It should be non-punitive, okay? Um, and as I mentioned earlier, organizational learning should be evident. The procedures and systems are perceived as good as at preventing errors. There should be enough staffing. The ratio you should always try to go for the correct ratios. And find that there is teamwork, cooperation, and coordination across and within the units. Now, I put aside this part of my talk on notes of interest. These are just like research papers that I couldn't organize into my presentation. But in one paper, it said that seeing errors as the result of embedded unsafe practices, part of the culture, yung minana-mana, rather than an individual failing, is better than calling it or blaming the person, blaming the individual. So the solution proposed is an implementation of standardized processes and designing out the error. Because sometimes we don't realize that there is an error in the SOP. Minana-mana na lang eh. But when we do see that, we have to review that SOP and design out, remove the source of the error. The other paper I saw was about dramaturgy of hospital boards in England. Apparently, the hospital boards that run the hospitals there are composed of mostly non-clinical people. So there was a lack of identification with pertinent issues that belong to the hospital. They found that if a lot more of the hospital board understood the clinical issues that go on in a hospital, it would be better to start. It would be easier to start or develop a safety culture. Siyempre, naintindihan na nung hospital board, bakit ganito, bakit ganyan. Also, if the board was more formal in that there's really a place where they're organized and they meet and they're able to talk without blame or pointing out fault, and the venue was conducive to open discussions, it was more effective than um, than not having an actual place to meet. So it's important that you have the venue to meet and talk about the similar issues every time. Okay. Then that was about enacting corporate governance of healthcare safety and quality. The third thing that I would really like to share is about mortality reviews. There's really a variation in the way we review our mortalities, and also most possibly a lack of integration of the outcomes of these meetings into the hospital's governance framework. How many of you really incorporate the minutes and submit the minutes to your medical center chiefs or the chief of clinics? If there are really minutes there. So this study introduced a standardized mortality review process, which can improve the accountability of mortality data and support the quality improvement without compromising professional learning. I like watching that. But anyway, mortality review should be more than a forum for peer review. Hindi siya pang excitement lang o makinig tayo kasi SRO ang showing sa mortality review. What they propose is that there should be a directed line of questioning where the junior doctor's training should focus more on the systematic process change and less on medical error. So there's a capacity to formalize organizational memory. And the paper trail, because of the minutes, improves the likelihood of corrective measures being undertaken. It's surprising, but the author said that there was actually more acceptance of this tool because many doctors now are co-opted into managerial roles and expected to take responsibility for governance. And because this tool is actually a value system and makes the provision of governance data easier, then it's really welcomed by the doctors. Historically, only doctors attended mortality reviews, right? So there's a silo mentality na tayo lang may alam nito na kasi nakakahiya. There's a fear of embarrassment and the loss of reputation, so it makes people reluctant to speak openly about errors. And this defensive behavior is counterproductive to eliminating adverse events. The U.S. Agency for Healthcare Research and Quality has produced a web-based guidance for case analysis. Our hospital is also trying to work on a directed tool for mortality reviews. Now back to our now on to our OSH story. It's really very short. We paid 325,000 pesos to the College of Public Health to conduct 11 meetings online. I think we did this 2022, so it was during the pandemic. And we graduated, got our certifications. Okay. And came up with a Gantt chart where our draft OSH manual was written out, and at the end of it, we want to have it ISO accredited. So that's where we are for our occupational safety and health. The next, okay, this is very brief now. The Philippine Hospital Association's new advocacy, as proposed by Dr. Gina Nazareth and Dr. Terence John Antonio, is about in-lab for patient safety, or the Innovation Lab. Based on the Admin Order 2020-0007, we are trying to create a platform to collaboratively address key patient safety issues and challenges, fostering innovative solutions for implementation across healthcare facilities, government or private. We are emphasizing the importance of prioritizing, advocating for, and facilitating patient safety research as a pivotal strategy for the comprehensive implementation of patient safety initiatives across all facilities. So these are the objectives: to generate concrete, implementable solutions related to patient safety, foster camaraderie because we want to have some teamwork here, and in the end, publish a compendium of solutions that can serve as reference to health facilities. And this is also, well, bragging rights. You got yourself published. These are the details of our program where it's still a work in progress. And I'm just sharing it to you because you might have the edge of forming your teams early and talking about what you want to research on. We're looking at possibly launching this in August during National Hospital Week, where I think the day before, August 6th, okay, because I'm recording this before August. Um, on August 6th, we are launching this during the Thelma Clemente Memorial Lecture and hoping that our member hospitals will join. Teams are very much welcome, but individual hospitals may also submit their entries. There will be a 2 to 3 day kickoff event with presentations, maybe around the annual national convention in November. This schedule is not yet finalized, okay? But the hospitals who will be featured will talk about their initiatives. We may or may not have mentorship. These are all still being discussed. But what we want to have is consolidation into a compendium. Whether or not we have seed money, that entails some fundraising by the PHA, which the PHA is still studying. But definitely, fundraising will be done for the compendium. So I just wanted to share this with the group so you can start thinking about it. So I think this is the end of my lecture. Thank you very much for your attention and stay safe.
Thank you so much, Dr. Ataiza, for the thought-provoking discussion. We are so lucky to have you with us. So, this will be the time to ask your questions for Dr. Ataiza. Please don't miss this chance. Put in your questions in the chat box. And please, may I remind you, please do indicate your institution so we can recognize you properly. I now welcome Dr. Ataiza. Good morning, Doctora.
Good morning.
So we have a few questions here, Doctora. We have a question from the NKTI QMS auditor. His question is, how has the safety routes you did for your hospital improved the culture of safety? And maybe you can cite a specific positive outcome. Thank you, Doctora.
Thank you for the question. The screen is over there, so it's medyo hard. Okay, QMS. That's a tip also for the nature of my answer. We have probably had 15 years of continuing quality improvement contests where safety issues are also addressed. And there have been winners about antibiotic safety. There are contests, there are papers submitted. They wear this pink vest where the nurse administering or preparing the antibiotics should not be bothered. And that laryngoscopy procedures para hindi ma-extubate agad. Those are just examples of, okay, IV burns, how to avoid the IV burns. So the employees of the hospital, all divisions have made their researches, have submitted it yearly for the yearly contests, and um, I guess they enjoy it also. There's a little bit to earn from that, but a lot more um, bragging rights. We've also submitted these papers to contests internationally, and they've also been rewarded. So um, that is certainly positive reinforcement for the attitude we have towards safety. I hope that answers the question.
Thank you, Doctora. I'm sure we can adapt some of your practices for safety. Doctora, we have another question. Another question from Manila Doctors Hospital. Is the DOH considering establishing a guideline for the use of acceptable abbreviations and symbols in the patient chart?
Hello, Manila doctors. Is that because DOH is rife with all these acronyms that I also don't understand most of the time? The culture of acronyms is really in the DNA of the DOH. I'm not aware, um, but you know that when we do our ISO and when we do PhilHealth accreditation, our our charts have to be understood. And we cannot just invent our own acronyms unless we identify them via legend whenever we submit documents. I really encourage everybody, all medical, all healthcare workers, to use only the most, things we learned probably in school or things that we really understand universally, because inventing your own acronyms is not going to support your defense if you have to defend your paper, your chart in court, or to get PhilHealth reimbursement. So I think that's very important. I don't know if DOH has the time to do that.
Thank you, Dr. Ataisa. I hope we answered your question. Doctora, we also have another question here from Zamboanga City Medical Center. Is there a proposal within DOH to institutionalize OSH in DOH hospitals? And how can leaders integrate safety into the core values and daily operations of an organization?
I'll go to the first question first. Is there a proposal? Um, we're hosting national safety, or is it patient safety? I think next year, or is it this year? I'm not sure, but the secretary um, has accepted the hosting of that. It's an international thing, so I guess that's not far behind to institutionalize OSH in DOH hospitals. In fact, we're quite late if you think about it, because OSH has been around for private institutions forever. And well, we only had time to do this OSH during the COVID pandemic, where we could get online training. Unfortunately, all the trainings usually had to be face to face, but before COVID or during COVID, there was more access online, and that's when we made the resources available so that we could get the online training from UP College of Public Health. And how can leaders integrate safety into the core values and daily operations? You have to be thorough. You have to be conscientious about your message. It's always safety first. Safety for the patient, safety for the employees. You should have no doubts or second thoughts about putting safety first. that message should always be first. How to incorporate it? Well, then you walk the talk, you put your resources into it. 320,000 pesos is a sizable amount for investing in education for the OSH. And that's what we did. Because we believe that we should be more aware in campaigning for OSH. Even before we are required. That's one thing. I don't believe we should wait for guidelines. There are guidelines out there that we can follow. And while you are ahead, you can create that universe that you want to live in. You create your own factor, your own conditions. That gives more satisfaction, I think, for the employees and for the organization that you're able to chart your own course in developing your organization. So, believing that money is not as important as your employee safety or your personal safety, the right attitudes, the right values, that should make it easier for you to incorporate safety into the organization's values. Thank you.
Thank you, Dr. Ataiza. For everyone, you may notice that Dr. Ataiza and I are looking from our side because Dr. Ataiza has given us the privilege to be on site and live with us. So thank you so much, Dr. Ataiza, for gracing us with your presence. So I feel very privileged that I have with me an esteemed expert in our field. So, Doctora, there are so many questions more. Let me read a few more. From R2TMC, what is the recommended patient safety officer in the tertiary 500-bed capacity? And do you have a specific ratio for patient safety officer per bed capacity or per patient number?
There is a specific ratio that the OSH authorities give you. Even to get yourself ISO accredited for OSH, that's a different ISO accreditation. That's what we're trying to pursue, no? Although, of course, I can't give you the specific ratio, but what I did was get different safety officers from the different areas, different fields, so that they could better communicate to their colleagues what the principles were all about. So I think it's really your strategy on how to put it, but there is ratio, and you had best consult the OSH authorities. Try the College of Public Health, UP. Thank you.
Thank you, Doctora. Doctora, we still have a few more questions. From ACE Medical Center Cebu, what are the biggest challenges encountered in implementing the safety policies?
I'd say number one, always the resources, financial or human resources. Financial, of course, because it costs. It's not just signages, but buying training, conducting those refresh sessions for the staff, advocating. That also costs something. And then when you say human resources, okay, you get the doctor, you get a nurse, you get an engineer. They have other core activities, duties that they have to attend to. And then you add the OSH on top of that. So everybody's multitask. So it has to be an acceptance of the multitasking and the multidimensional duties and responsibilities we have to cover because we are merely protecting ourselves. And I think that should be number one, to protect ourselves.
Thank you, Doctora. I completely agree with that statement. And I guess the last question from the Phi Gamma chapter, Rita Munli Gallagher. The Joint Commission reports failures in communication, teamwork, and consistently following policies as leading causes for reported Sentinel events. How can a blame-free culture be instituted in order to ensure reporting of errors, both of commission and omission?
Um, one of the one of the recommendations is anonymity. If there is a system where they can report, I think Heart Center, the nursing division has this, where you can report incidents anonymously, then less blame. Because it's really human nature. I mean, personally, I'm also guilty of that. Sino may kasalanan niya? Sinong gumawa niya? Diba? That's human nature because you want to correct, not really to blame, but you want to correct the misconceptions of the person who initiated the error, di ba? Um, but yun nga when you are able to provide anonymity so that reporting is done, there's no blame. Okay? Perhaps you might blame the culture, but that's where the greater challenge is, changing that culture. It's always a challenge every day. You know, I've been in this job for many decades. um, I was telling Dr. Lauderes this morning, the challenge is being optimistic every morning, every day you come to work. Okay, what good am I going to do today? Am I sick and tired of doing the same thing every year, every day? It's really just uplifting yourself, your work, so that you know that you are uplifting your employees also at the same time. You are protecting your employees when you pursue or when you campaign safety. Um, so you shouldn't be blamed for that. You should just try to strategize, okay, how do we make it more interesting? How do we make it more sexy for them to pursue work safety? Okay? Yun ang challenges for the leader, I guess. Because humans will always be humans. Thank you.
Thank you, Dr. Ataiza. As a nurse leader myself, I will definitely have a lot to ponder about. So moving on, if no one has any more questions for Dr. Ataiza, we will now proceed in the awarding of the certificate with the following citation. Republic of the Philippines, Department of Health, San Lazaro Compound, Rizal Avenue, Santa Cruz, Manila. Certificate of appreciation is given to Dr. Maria Lourdes Otaiza for sharing her knowledge and expertise as a resource speaker during the first Department of Health National Hospital Summit with the theme Safe Hospital, Strengthening Advancement and Fostering Enhanced Collaboration in Patient Care. On the topic, leadership's role in fostering a culture of safety, held on August 7, 2024 via Zoom platform. Given this 7th day of August 2024 and signed by the co-chair of the first DOH National Hospital Summit and the Medical Center Chief 2 of the National Children's Hospital, Dr. Philip A. Morales, and the chair and the first of the first DOH National Hospital Summit and the Medical Center Chief 2 of Jose R. Reyes Memorial Medical Center, Dr. Wenceslao S. Lauderes. Once again, we are very grateful, Dr. for taking your time from your very busy schedule to grace us with your presence. Your presentation definitely opened new doors for inspiration in exploring and discovering roles in fostering a culture of safety. Once again, thank you so much, Dr. Ataiza. What an interesting topic. So, guys, how are you guys doing? I'm sure you learned a lot from that discussion. Isang topic pa lang yan. Do you have any comments or maybe you want me to shout out your institution? Please type in where you are attending from in the chat box. So, do we have anyone coming from Luzon? We have a lot of comments coming in. Greetings from the Bicol Medical Center. Sir Fredriel Tornates says thank you, Dr. Ataiza. From Davao City, Ms. Cecile Enriquez, greetings. From BMC Naga City, greetings also from Mother Teresa of Calcutta Medical Center. Welcome to our audience from Washington, D.C., USA. Thank you, Dr. Ataiza from Valenzuela Medical Center. And from Vicente Soto Memorial Medical Center, welcome everyone. We have visitors from Northern Palawan Provincial Hospital and from East Avenue Medical Center, Quezon City. Welcome everyone. Amay Pakpak Medical Center, welcome. And NKT IQMS Auditor from NKTI, welcome. From St. Anne General Hospital Incorporated, welcome. Maricel Lapid sends her thanks, Dr. Ataiza. From the Sorsogon Province, welcome everyone. And from the Brent Hospital from Zamboanga City, welcome to our program. Thank you everyone for your active participation. I will be reading the rest of your comments in a while. We would like to thank everyone for your extreme and overflowing support. Wow, we have already reached our maximum Zoom capacity. But for those who cannot access the Zoom platform, don't worry. You may go to our official Facebook page from the DOH and JRRMMC live streaming feed. The link will be sent to your to the Zoom waiting area. Don't worry, rest assured that the same quality and educational lecture will be accessed. Certificates will still be issued upon the completion of the second day summit with accomplished evaluation form. Again, thank you everyone. And for now, we will be having a 5-minute health break. You may use this time to hydrate, relax, and prepare for our next speaker. I will be here waiting for you, so please make sure to come back after 5 minutes. See you. Welcome back, everyone. Is everyone feeling better? I'm sure you have a lot of energy now. Shout out to our viewers from the live streaming from the DOH and JRRMMC official Facebook page. Are you guys still there? Sana samahan niyo ako hanggang dulo. Hashtag walang iwanan. So, I think everyone's ready. So, let me proceed by introducing our next speaker. Our next speaker holds a Bachelor of Secondary Education, major in mathematics, graduating cum laude from the Cebu Normal University, and is a licensed professional teacher. He further pursued a Master of Science in Public Health, major in Hospital Administration at the University of the Visayas. He earned his Juris Doctor from the University of Cebu School of Law and is a candidate for a Master of Laws at San Sebastian Recoleros, Manila. He is a dedicated educator, serving as a graduate school professor at the Cebu Normal University, a professor at CNU VSMMC College of Medicine, and a non-resident faculty member at the University of Cebu Banilad campus. He is a certified human resource management executive, certified hospital administrator, and registered data protection officer. Additionally, he is an ISO 9001-2015 lead auditor and ISO internal auditor. He served as a hospital administrator and department head for the Cebu City government at the Cebu City Medical Center. A senior partner and counsel at the PPR and Partners law firm, Manzawi City, Cebu Province. His roles also include management consultant, legal retainer, and organizational developer and strategist. Additionally, he is the Director of Human Resource and Legal Affairs, as well as the Data Protection Officer at the University of Cebu Medical Center Incorporated and St. Vincent General Hospital Incorporated. To discuss addressing workforce well-being for improved patient safety, please help me welcome the head of Office of Strategy Management from the Vicente Soto Memorial Medical Center, Attorney Ray Chris A. Panugaling. Let's give him a virtual round of applause.
Hi, good morning, everyone. Finally, I have now the. May I proceed?
Good morning, attorney. Yes, you may now proceed.
All right. Thank you very much. To the Department of Health and to all our partners and champions in healthcare, and a pleasant morning to all of you. Maayong buntag, maayong adlaw, gikan sa Vicente Soto Memorial Medical Center from Cebu City. Special thanks to GRMMC and the NCH for organizing this DOH Summit. Today's resource person does not have any relevant financial interest, presenting a conflict of interest to disclose. The presentation is a consolidation of work of several authors and mentors cited in reference. Images are from Google website, coming from various authors and owners. Let me ask you with this generic question. How are you? Kumusta? I hope you can type your answers in the chat box or show your heart reaction via Zoom platform. So you are given time to write your answer about this generic question of how are you? Kumusta? As the rest are typing their answers, let me give you the key points of this discussion for today. The first one is on conundrum and research. The second is on human assets. The third is on workforce well-being. The fourth will be on occupational safety and health standards. Number five is on best practices. And number six is the EX is equal to CX and ES is equal to PS. So whatever your answer to my first generic question that I asked this morning, please be reminded that it is okay not to be okay. It's normal to feel sometimes that we are not okay, especially at workplace. In one study entitled Stressors Among Healthcare Workers, a summative content analysis published in 2023, it was found out that 70% of healthcare workers are experiencing high stress and burnout, thus hindering patient care. In the same study, the respondents, healthcare workers, described three main types of stressors, including work, which comprises 49% of stressors, personal life, which includes 32% of stressors, and stressors that intersect work and personal life, which delivers 19% of stressors. This study has produced new insights on day-to-day stressors that are not neatly compartmentalized in one area of life, and instead, it could be related to work, personal life, or the intersection of both. There is also a need to address the complex sources of stress, inclusive of work and personal life, for future studies. The healthcare workers' stress and burnout also has a harmful influence on patients. Increases in medical errors are related to nurse stress. And please take note that it will also include physician burnout. Another key element of patient safety linked to healthcare workers' burnout are hospital acquired infections. Lower patient satisfaction has also reported in the setting of higher burnout. And additionally, and of great significance, research has shown that the length of stay is longer and risk of patient mortality is higher in settings with high nurse burnout. Research assessing the sources of stress and burnout among healthcare workers is often currently focused on work environment. Let me start with well-being from Tom Roth of Gallup Management. The most articulate, successful organizations are now turning their attention to employee well-being as a way to gain emotional, financial, and competitive advantage. According to Fried and Fotler, healthcare professionals are central to the delivery of high-quality healthcare services. Extensive training, education, and skills are essential in meeting the needs and demands of the population for safe, competent healthcare. Healthcare professionals acquire these specialized techniques and skills through systematic programs of intellectual study that are the basis for socialization into their profession. Additionally, healthcare industry is labor intensive and is distinguished from other service industries by the number of licensed and registered personnel that it employs and the variety of healthcare fields that it encompasses. These healthcare fields have emerged as a result of the specialization of, of medicine, the increased scope of advanced practice nursing, the development of public health, and increased emphasis on health promotion and prevention, and technological advances and growth. Managers at all levels are becoming increasingly aware that critical sources of competitive advantage include appropriate systems for attracting, motivating, and managing the organization's human resources. Adopting a strategic view of human resources involves considering employees as human assets and developing appropriate policies and programs to increase the value of these assets to the organization. Effective organizations realize that their employees have value, much as the organization's physical and capital assets have value. Viewing human resources from an investment perspective rather than variable cost allow the organization to determine how to best invest on its people. This perspective, however, leads to dilemma. An organization that does not invest in its employees may be less attractive to both current and prospective employees, which causes inefficiency and weakens the organization's competitive position. Consequently, an organization needs to develop strategies to ensure that its employees stay long enough that it can realize an acceptable return on its investment in employee skills and knowledge. This is very much relative to your workforce well-being. Not all organizations realize that human assets can be strategically managed from the investment perspective. Management may or may not have an appreciation of the value of the organization's human assets relative to its other assets. Organizations may be characterized as human resources oriented or not on the basis of the following questions. Number one, does the organization see its people as central to its mission and strategy? Do the organization's mission statement and strategy objectives mention or espouse the value of human assets? Or number three, does the organization's management philosophy encourage the development of any strategy that prevents the depreciation of its human assets? Or does the organization view its human assets as a cost to be minimized? I hope the leaders in this room shall have the ready answers to these valuable questions on making human assets the paramount consideration. Indeed, those are the most significant inputs relative to the value of human assets. This lecture involves the cause and effect relationship. The cause is addressing workforce well-being, being the means, and the improved patient safety as the effect or the end. This is indeed a very crucial relationship in the area of workforce well-being. The World Health Organization defines well-being as a positive state experienced by individuals and societies. Similar to health, it is a resource for daily life, and it is determined by social, economic, and environmental conditions. Corollary, WHO also defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And wellness, on the other hand, is the optimal state of health of individuals and groups, and it is expressed as a positive approach to living. If we are asked with this question, what is the most important thing in your life? The common answer may be other things. It can be something material, it can be about family, it can be about career, other than the most important thing, which is health. Let us be reminded that health is wealth. Health is human right, and for everyone at every stage. The components of healthcare system include the healthcare professionals who shall carry the vision and mission of their own professional affiliations. Therefore, their willness be a paramount consideration for them to deliver the services. Healthcare system cannot be successful without the healthcare professionals, the workforce. Noteworthy is to be refreshed with the determinants of health, which include the host factors, the social factors, our lifestyle, and our environmental factors. Health is a resource for life and not the objective of why a person lives. Therefore, health, it means resources for resiliency and not attainment of independent living. So a healthy person then has the following characteristics. You can maintain your homeostasis, you handle and cope stress, you acquire skills, build harmonious relationships with other people. And this includes a holistic physical, mental, spiritual, and emotional well-being. And positive wellness includes the following: being free from symptoms of disease and pain as much as possible, being able to actively able to do what you want and what you have to do at the appropriate time. And lastly, being in good spirits most of the time. It is important to note and to understand and observe the body and mind to achieve a homeostasis in one's body, mind, and spirit. And there is a way of ensuring health in a negative sense. It is measured by the 5 Ds. It can be death, disease, discomfort, disability, and dissatisfaction. If there is an absence of the 5 Ds, then we can say that a person is healthy. Which D is affecting you now? Which D is affecting your well being? At this point, let us visit workplace wellness relative to occupational safety and health standards. The golden mantra of "we cannot give what we don't have" is highly applicable in healthcare. We cannot expect of patient safety without addressing employee safety and well-being. So let us visit significant definition of what a workplace is. It refers to a place, an establishment or agency where people are employed, hired, which includes working areas, employee lounges, and restrooms, convention halls, classrooms, employee cafeterias, hallways, and quarters, if there are any, as well as, take note, the office vehicles or shuttle. The International Labor Organization defines workplace well-being that relates to all aspects of working life, from the quality and safety of the physical environment to how workers feel about their working environment, the climate at work, and the work organization. The aim of measures for workplace well-being is to complement OSH measures to make sure that workers are safe, healthy, satisfied, and engaged at work. Even our Constitution provides in Section 18, Article 12, the state affirms labor as a primary social economic force, and it shall protect the rights of workers and promote their welfare. And as well as paragraph 2, section 3 of the Constitution guarantees the rights of all workers to a decent and humane conditions of work and to participate in policy and decision-making processes affecting their rights and their benefits. These are provided by law. Who doesn't want to work in a safe workplace? I believe the resounding answer, the unanimous answer is no one. No one would like to work, di ba, in an unsafe workplace. And a safe workplace helps improve the production and employees' efficiency. For those hospitals or healthcare organizations in the private sector, the Department of Labor and Employment issued Department Order 198 provides that employers are required to implement measures that protect workers from various hazards. This leads to a significant improvement in the overall safety and health of employees. reducing the incidence of work-related illnesses and injuries. And for those in government or public sector, the Department of Health, Civil Service Commission, and Department of Labor and Employment issued a joint memorandum order, Administrative Order 2017-001, also known as the National Occupational Health and Safety Policy Framework. To bolster this directive, the Civil Service Commission, the Department of Health, and the DOLE issued Joint Memorandum Circular Number 1, Series of 2020. This was released detailing the guidelines on occupational safety and health for public sector. These guidelines on occupational safety and health standards for public sector is aimed at protecting all government employees from danger, from injury, sickness, or death in the workplace through the adoption of safe and healthy working conditions to ensure the preservation of human lives and resources and prevent loss or damage of properties. The highlight of the guidelines include the provision for reasonable working conditions, which include the workplace, emergency preparedness, occupation safety and health program, the support program, the working hours, breaks and leaves privileges, as well as the work environment. The better working conditions contribute to the overall well-being of workers like you, like all of us, making the workplace more comfortable and conducive to productivity. A risk management reduction management system and crisis management system or plan and contingency program in an emergency situation within the agency must be established as provided by the Philippine Disaster Risk Reduction and Management Act of 2010 or RA 10121. Trainings and drills on disaster risk reduction management must be conducted to ensure employees and staff are prepared during the emergencies. Occupational safety and health program may include occupational accident and illness prevention program, medical services assistance and rehabilitation program, occupational accident and illness surveillance program, the information and education campaign program. When you feel safe and healthy, you are more likely to perform at your best. Downtime is significantly reduced because of fewer accidents and illness, and therefore, productivity increases. Occupational safety and health program may also include promotion and practice of health and wellness in the workplace. This leads to a significant improvement in the overall safety and health of employees, reducing the incidence of work-related injuries and illnesses. Support facilities may also include work assignments and good working atmosphere for improved productivity. Working hours on break and privileges shall also include leaves, working breaks, overtime services, and some flexible working hours as well. The work environment shall implement policies and programs relative to smoking, drug-free workplace, tuberculosis, HIV and AIDS, hepatitis B, medical assistance, etc. These are known to the employees while onboarding or for new employee orientation. Relevant guidelines were also issued by Civil Service Commission and the Department of Health, respective with these respective circulars on the screen on work environment. The question is, how do we promote now occupational safety and health in our organization? Let's start with number one. Agency heads shall ensure comprehensive dissemination of OSH information through a communication plan, which includes the publication of your pertinent OSH information in the agency, website, and other communication materials, and the establishment of feedback mechanism which shall be utilized to enhance the OSH program. Number two, employees shall participate in the OSH information and education programs, training, and other related initiatives of the agency to contribute to the improvement and sustainability of the same. Number three includes employees shall report OSH-related illness and accidents to the management in order for the latter to act and provide the necessary intervention, thereby enhancing the OSH program. Number four, this will establish network to support and sustain implementation of OSH program with the DOLE, with the DOH, and other academic institutions which can provide the trainings, technical, and medical assistance. And number five, ensure that OSH programs and activities are included in the annual work and financial plan of the agency, so the WFP. So, how do we now ensure compliance to occupational safety and health? This will help in addressing actually the workforce well-being. Number one is to designate a safety and health officer. Number two is to constitute a safety and health committee. Number three is to maintain records requirements as well as record keeping. And lastly, ensure continuous monitoring and evaluation for OSH programs. These are the four basic activities or compliance requirements that an institution, both public and private, can do. And this is also based on the circular cited a while ago. And if you want to go further, your organization may also be certified with ISO 45001:2018 that shall provide the framework for managing OSH risk and opportunity. Its aim and intended outcome to number one, prevent work-related injury, prevent ill health to workers, and provide safe and health workplace. So my institution is also on the pipeline for this ISO certification soonest. With a universal healthcare or UHC being the people at the center of a center principle ensures that people needs and well-being is given the topmost attention. With the leadership of the Department of Health Undersecretary Teodoro Herbosa, the 8-point action agenda is introduced as the medium-term strategy of the health sector for 2023 to 2028. Everyone is inspired with Sa Healthy Pilipinas, bawat buhay mahalaga. Relative to addressing workforce well-being, I made particular emphasis on Action Agenda number 6 and Action Agenda number 7. Action Agenda number 6 focuses on enhancing Filipinos' well-being and ensure quality mental health services, and these include, of course, the workforce. Action Agenda number 7 focuses on healthcare workers for advancement and protection of health workers' rights and well-being. And these include to ensure adequate, competent, and committed healthcare workforce by providing fair compensation, decent work conditions, and opportunities for career development. This is evident that this Department of Health leadership and administration include the healthcare workers on the priority and consideration in the strategy map for the 8-point action agenda. Allow me to give emphasis on humanistic leadership espoused in the strategy. This leadership approach calls on all stakeholders to demonstrate genuine empathy, care, and support for others. The essence of this leadership style is its service-driven and people-oriented nature. Hence, we take people as the central reference for development. And even the governance framework and management systems such as PGS, QMS, SPMS, and even national policies will always make people the central reference, being part of the process and development. Development is by people, their productivity, for people, their welfare, of people, their improvement as individual human persons. The human resources of every institution plays a vital role in ensuring workforce well-being by performing HR role framework that includes being a strategic partner, being a change agent, being an administrative expert, and being an employee champion. But please take note that HR is not an HR office work alone. Every manager is an HR professional. Hence, we are expected to be employee champion and change agent in our organizations. For the leaders and healthcare workers, we know that we are already in the fifth industrial revolution that introduced the human robot collaboration, cognitive systems, and customization. Yes, human will never be replaced with artificial intelligence. But one thing for certain, humans will be replaced with humans with artificial intelligence, or those who embrace these technologies of modern world. However, we need to ensure that having these present technologies would never affect well-being by using without limits such as 24/7 work messages and instructions via different platforms, making people very reachable anytime, even at midnight, without realizing that this is deteriorating our mental health as well and well-being in general. It is time to define workplace protocols relative to the use of these technologies to prevent any abuse or overuse. For sure, what we need to ensure well-being is the balance for everything. Balance for perspectives, balance for various interests. And I'm sure everyone is very articulate with what we call work-life balance as well. For the leaders and managers in this room, let us be reminded of the story of the golden goose and that lays the golden eggs. Effectiveness lies in the balance, what we call the P and PC balance. P stands for production of desired results, which are the golden eggs, and PC stands for the production capability, the capability for, or asset that produces the golden eggs, our people. Stephen Covey defines this balance. Let us remember to think of ways to nurture our golden goose, our workforce. Their well-being is necessary to ensure quality results in patient care. Care for this to get more of this. Allow me to share
No, sir. Okay
some
na.
best
Okay
practices
na, mamaya na,
of
sir.
my
After nyo na
healthcare
lang.
organization relative to workforce well-being in Vicente Soto Memorial
After ko, sir.
Medical Center.
Thank
In
you.
VSMMC, we believe everyone is a healthcare worker
Ladies.
without distinction and discrimination. Kalidad nga serbisyo among garbo
Oo
is
nga, sir.
institutionalized as a mantra
Congrats.
that drives the institution forward for a strengthened identity, branding, and reputation. This is embodied through the Soto brand of care with a hand gesture with the
Oo
right
nga, sir.
hand over left. This encompasses the
Okay.
organizational culture of
Okay.
emphasizing mission, vision, and core values towards the employee care and wellness. The leadership team encourages a collective acceptance of change throughout the healthcare organization, from our senior leadership to the workforce. This is deemed necessary